Hey folks, it's Dr. Mike here, and this is the first in a series of videos that looks at the 6-point medical exercise training program management concept. Now folks, we've been teaching our MES for 26 years. And with that program, when we started it back in 1994, we wanted to make sure that our medical exercise specialists had a very clear understanding of how to manage medical conditions utilizing exercise. Now, let me make this clear. This was not to be used in lieu of physical therapy, chiropractic, or medical services, but was to augment those services after clients were discharged from PT, OT, whatever the case was. One of the things that we were concerned with when we started those programs back in the 1990s, our biggest concern was, would you be able to critically think as a medical exercise professional to come up with safe and effective exercise programs? What we did not want was simply, here's the condition, do these exercises. We felt that actually caused more harm than good. If I'm just simply a trainer and I know the exercises for a condition, but I don't understand how I apply them, that's the same as a doctor. When you walk into a doctor's office and you have hypertension or diabetes and they just give you a medication. If we don't like the medical community doing it, we should not like the medical exercise training community offering it. We also see a proliferation of medical fitness and post-rehab fitness certifications, and we see the majority of them are simply, here's the condition, do these exercises. So if you don't mind, for a few moments here, we're going to talk about this 6-point program. Now, this is the first in a series of videos, and with the subsequent videos, I'll get into each one of these separately. But if you don't mind, I just want to go through these. Now, notice we have a path here, okay? And this is the client training path, or the medical exercise training path, for lack of a better phrase. And you'll notice we have some key points along the way. The first one is, as the medical exercise professional, when that client walks in the door, you have to have a clear understanding of the anatomy and pathology of their condition. Everything in the healthcare world is based on understanding anatomy and pathology. Notice we have here clinical anatomy and pathology. That doesn't mean just simply muscles and bones. It means you need to understand the underlying disease process or pathology and how it's impacting the anatomy of that client with regard to their condition. So you've got to understand that, which means also you may need to contact the doctor, the therapist, or the chiropractor, or if the client is a good historian, what is their actual diagnosis? The idea of utilizing the phrase, they have a shoulder condition, or they have a knee condition, folks, that doesn't cut it anymore. Because what you may do for a shoulder condition, when we actually find out it's a meniscal tear, may be something that if we find out that shoulder condition actually was something else, we may find out the general exercise you gave the client is making them worse. There is a difference between the management for a meniscal tear and an ACL tear. You've got to find out specifically what's going on with that client. So we need a clear understanding of the anatomy and pathology. Number 2, recognize the contraindicated activities and exercises. So not only what exercises you shouldn't do, but what activities the client is doing on a daily basis that you need to minimize or limit for the client. That becomes important. Number 3, understand the key assessment procedures that need to be used on that client. What key areas do you need to assess based on your understanding of the client's clinical anatomy and pathology of their condition? This makes a huge difference. If you're assessing the wrong thing, you never can tell if the client is getting better or not, but you also don't know if the client is appropriate for the exercise program. Number 4, incorporate the indicated activities and exercises. So when you find out what the client's condition is, based on the anatomy and pathology of that condition and your understanding of medical exercise training guidelines, what are the activities that are good for this client? What are the exercises that are good? So notice we say activities and exercises. Activities, let's say it's a client that has a disc herniation. Obviously, we don't want them sitting. That would be contraindicated. But we do want them, they will have to sit if they're working. Maybe they get up every 15 to 20 minutes and do some type of spinal extension exercises. So that's an indicated activity for them. The exercises, obviously, we're going to incorporate the indicated exercises into the program. And we want this program to be safe and effective, which means we may phase in certain exercises along the way. In the early stages, we may not do certain exercises, but in the later stages, we may add these exercises. So it's important that we understand number 4. Number 5, understand progression guidelines and functional goals. So if we're doing all of this, where are we going? What are our short-term and long-term goals with this client? What are our guidelines for progressing the client along the way? And then lastly, use a protocol-based approach. That simply says, folks, that this shouldn't be just a hodgepodge that you've thrown together. You've looked at these 5 concepts here, or these 5 points here, and based on that, you now come up with a approach to this. But let's say you're managing a total hip replacement client that's an anterior approach. You see a client coming in with a similar condition a year later. The approach to that should be roughly the same as far as the exercise programming approach, which means we now have a protocol that's been established because the anatomy and pathology doesn't change. The contraindicated activities don't change. The things we need to assess, the key points, don't change. The indicated activities shouldn't significantly change. And the progression guidelines and functional goals shouldn't change. But the only reason we may see changes in these is because the client may have a primary diagnosis, but they have something else, a secondary issue going on also. So now again, you're not trying to take the place of the doctor, the therapist, and the chiropractor applying medical services or any type of treatment, but you do want a safe and effective exercise program. And eventually over time, we should see that what's done for a total hip replacement client in Fort Worth, Texas, is something similar done by a trainer for that client in Seattle, Washington, or what's done by medical exercise specialists here in the United States is very similar to what's done in Europe. The only differences will be if the client has secondary issues going on. Along with that, what type of environment are you training the client in? But the key component here is the muscle groups that we're training, the safety guidelines that we're utilizing, whether you're training the client at home, in a gym setting, they should all roughly look the same. Okay? And what that does is it raises the level of professionalism across the board. So if you want to get more information on our programs, you can go over to postrehab.com. You can get information on our PRCS program, our MES program, or our MEPD program. You can see we've been around doing this for 20 plus years. And I think along the way, we've helped medical exercise professionals across the world on 6 continents build successful practices, develop relationships with medical professionals, and most importantly, produce outcomes for their clients. And that's where this 6-point program comes in. This is the key process you need to understand. This is your thought process. This is your critical thinking process in managing medical conditions utilizing exercise. If your educational programs aren't giving you this, they're not preparing you to be both competent and confident in managing medical conditions utilizing exercise. So all the best. Again, if you want more information, go to postrehab.com and please tune in and also click the link below to actually join our list of subscribers so that you can get the next in a series of videos on this 6-point program. Thanks again. All the best.